So to start our program this morning, I would like to introduce John Wilson from the MITRE Corporation. He's our keynote speaker, and he's going to be addressing a vision of sharing medical analytics with the healthcare industry. He's the Vice President for Programs and Technology in MITRE Center for National Security. This center operates the National Security Engineering Center, which is a federally funded research and development center that MITRE manages for the Department of Defense. John applies his extensive experience in software engineering, embedded systems, and information technologies to advance program divisions and technical centers. Please welcome Mr. John A. Wilson.
Thank you, Glenn, for the introduction, and good morning, everyone. Welcome back to day two. We had quite the spectrum of presentations in day one, and as Glenn mentioned, we're kind of teeing up this whole challenge topic on sharing analytics. So I come to you with the background and perspective probably different from most in the room. I have no medical training to speak of, probably a good thing for me. And so my background is in IT and software. And what I'd like to do is to share some perspective on, the point in time that we're at right now, I think is a tremendous opportunity for innovation and transformation across a whole set of industries, but certainly in healthcare. And I was thinking last night, one way to get some perspective is to rewind the clock a little bit. So if you go back to 1996, the event at that point in time that I saw through the eyes of IT and software was the last restrictions on commercial internet use were removed at that time. You can probably remember if you think back 20 years ago. And that transformed the nature of distributed systems, where pretty much any industry, any business could really think about, fundamentally different ways of going about their business. And while it took 2 or 3 years to kind of gain momentum, and you may recall Y2K, it was a little bit of a distraction in there. The period of 2000 to 2010 was a phenomenal period in innovation, both from a technology standpoint, but from a business innovation standpoint. And those two things go hand in hand, the technology and these disruptive business models. So if you think back to that period in the 2000s, what are 3 of the major innovations? Well, one of the major innovations was around content distribution and production through crowdsourcing. So if you just think about the companies that popped up, starting with like Wikipedia in 2001, and you had Facebook, you had YouTube, you had iTunes that came into play around 2006. By 2009, they were the largest music retailer. So again, fundamental transformation around content, where basically, anything that could be captured digitally could be distributed for free. The second revolution was around the platform. So you recall, a whole period of kind of trials and maybe misfires a little bit around personal devices and personal assistants. You may remember the Palm Pilot and other devices. The iPhone came out, and so what was so fundamental about that was this idea of a citizen sensor, right? Everyone with a phone, it wasn't just a phone anymore. It was equipped with GPS, with a camera, with location-based services. And so essentially every person became a sensor. And that fueled a whole set of innovation around applications as well. And then the third transformation had to do with a big cost part of the equation, and that's around infrastructure. right? So this notion of on-demand, elastic infrastructure that could be shared across organizations. And it started primarily with computing, but it moved into platforms, it moved into software as a service, and so you had Amazon and Microsoft and others kind of getting into the game around in 2008. So that period of 2000s was a wild ride, and yet we look back and we take that for granted. So if you think about where we are today, I think we're at another point in time where there will be this rapid acceleration in innovation. And it is largely driven by, and many of the speakers yesterday talked about different aspects of it, the Internet of Things. So the projections are by 2020, there will be over 6 billion users with cell phones, a growth from around 3 billion today. There'll be over 40 billion connected things, sensors, some of them that we'll be ingesting. We talked about that late yesterday, but over 40 billion sensors. So you think about the number of connections between these things and between users, and it is just, it's kind of inspiring to think about the possibilities. It's also daunting if you think about the amount of data that any enterprise, any of your organizations will have. The estimates are it will be between 2 and 3 orders of magnitude what you have today, right? So think of, I don't know if Rick Skinner is in the audience here, but any CIO thinking about that just it's an overwhelming thought to have 100 to 1,000 times as much data by 2020. So, and obviously the data in and of itself is not transformational. It's really the algorithms and the analytics that will realize the action on the data. So I give that as a little bit of a precursor, as we think about these opportunities for the challenge for sharing analytics for health outcomes. So, so Dr. Shannon kicked things off yesterday, and he mentioned the partnership that MITRE and UVA Health have entered about a year ago. And really it was in recognition that we bring complementary strengths to the table. MITRE has been in the systems engineering and technology business for 60 years, and UVA Health brings a whole suite of expertise around medical and health research and clinical technologies and that type of thing that we don't have. But we have a common outcome or a shared purpose in terms of a public service mission behind both institutions. And certainly if you think about what I just talked about on the scale and where we are in terms of growth and data and opportunities, partnering's the name of the game. It has become strategic to our company. We see the diversity of challenges across all of our sponsors, and they're challenges, frankly, that cannot be met by any one organization alone. So thinking of just a few examples, cybersecurity. The rate of change and the kind of the spectrum of challenges around cybersecurity, there are very few organizations that can take that on by themselves. And so the name of the game is how do organizations for a common purpose around security come together to share threat information or to share analytics around cybersecurity that they may be developing individually, but as a community they can leverage their collective innovation. Similarly, in other areas, what's known as anticipatory intelligence. So often on the news reports, you'll hear the reporters say, some event happened, but the government says we didn't detect any chatter leading up to the event. But the whole area of anticipatory intelligence on being able to sense and anticipate and warn when emerging threats are going to occur or opportunities are going to occur is only one that can be accomplished by many different organizations working together. And you can think about the applications in the health domain in terms of anticipatory intelligence around medical devices on your network. Again, being able to sense, being able to anticipate when things are going on the network. One of the topics, actually, a speaker hit on yesterday was, how do we harvest innovation much quicker than we do now? And there are different ways of going about it. One topic is to come up with challenge problems as a community. Think of a challenge where we want to bring innovation on board as quickly as we can. So we have one challenge that we're working across a whole set of sponsors that has to do with drones. And so fundamentally, the challenge is, if you detect a drone, how do you know if that's an adversarial drone? And if it is, number two, how do you neutralize the drone without collateral damage and causing things like that? It's a tough enough problem for one drone. Imagine doing it for 100 drones. So that's one where we opened up a challenge problem basically to discover small companies that have very specific innovations that would help to bring some novel solutions to that particular challenge. So one other example in the area of partnering, and I felt compelled to go after and dig up a medical example given the audience and the summit here. So we have a team in MITRE that's working with NIH on the topic of hybrid curation. And what this has to do with is NIH has over 1,500 biological databases. And so the task of curating that content, annotating it, marking it up, is an enormous task. They can't keep up with the amount of content. And so working with NIH and several other organizations, the partnership model is looking at hybrid curation. And what it involves is human language technology and analytics to pick out, to extract different biological entities out of the content. And human language technology is great for a lot of things such as that, but where it struggles still is with relations between entities. And so we use the technology to extract the entities out of a whole variety of content, and then use Amazon Mechanical Turk to crowdsource being able to identify relationships between these entities. So this is sort of an example of a scalable workforce going out to Amazon Mechanical Turk, bringing in this capacity. They have no medical training, and yet they can look at a body of text and the medical entities that have been extracted and intuitively be able to connect the dots and tell where they're relationships or where they're not relationships. The accuracy for a trained professional in medical curation working at NIH is around 90%, 91%. For the crowdsourcing method for doing medical curation, the accuracy ranges between 80 and 90%. So again, sort of fundamental business model derived with a set of partners to take a problem that NIH could not tackle on their own, and that is it's just the mass of content that they have, that they're trying to curate. So partnering, as Dr. Shannon said, it is a game changer to deal with the scale in data and to deal with different business models for shared outcomes. So a couple charts on MITRE, and I've had some questions over the last couple of days. I won't spend too much time on these, but we've been around for a long time. We're a not-for-profit, and we operate federally funded research and development centers. We started in the national security business, doing work for the Air Force around radars and command and control and that type of thing. We're conflict-free. That is one of the unique things. We're prohibited from manufacturing hardware or producing software. We can prototype technology for feasibility, for risk reduction, for experimentation, but ultimately, if something really takes off, then we've got to work with a partner to figure out how to transition it to industry, to academia, to an open source community. And we're focused in science and technology. We have our business in federally funded research and development centers. We started with national security. Our newest FFRDC is we operate the National Cybersecurity Center of Excellence. So again, a focus on cybersecurity, and we have a FFRDC, which is the CMS Alliance to modernize healthcare, hence our interest and our participation in the healthcare domain. Engineering focus, I mentioned. I'll just touch on a couple areas which, again, are capabilities that we can bring to the community because we apply them across so many government sponsors. So we operate 10 different technical centers. Think of these as kind of our technology backplane in areas like cybersecurity, information technology, modeling and simulation, emerging and electronics, in signal processing, RF, hardware, that type of thing. So it really runs a pretty good spectrum. We've got an innovation program which is both focused on sponsor research as well as internal research and development. A lot of laboratories that have access to different types of government systems and government platforms, which again, we can be kind of the objective steward for these types of systems, to experiment with them, to help evolve them. And then partnerships, really as a strategic area that we're focused on, which I mentioned. Okay, so analytic sharing, and I've sort of teed this up a bit with the earlier slides. So, you know, the data, the 2 orders of magnitude, 3 orders of magnitude. So, you know, think about the way applications now are created. It used to be, and you know, as a software developer, porting applications years ago was a big deal. It was labor intensive, it was time intensive. And the whole model of the App Store, right, again, which we all take for granted, really fundamentally changed the whole paradigm around development and distribution of applications for mobile platforms and for other platforms as well. That same thing is occurring in the analytics space. So if you look at the commercial push around vendors that are not only providing specific analytics, but beginning to provide frameworks for exchanging analytics, right, for bringing analytics into the marketplace. So a lot that is happening in this space, and that's going to happen in this space in the coming years. One thing I would encourage the group on is to not become fixated on one particular architectural model around analytics. So traditionally, I can say for our company, where we've done a lot of this work, we've tended to have a model of, well, how do you bring the data to one place where you can run a whole set of analytics, right? That's a fairly clean model to get your hands around. We've had some discussion over the last day about, well, if you can't move the data, and for a lot of reasons, in a lot of situations, that's going to be the case, then how do you project the analytics, actually move the analytics, you know, to the data? but allow the analytics that are running in different environments on different data sets owned by various institutions to be able to aggregate the insights that you're getting across the analytics. So there's a whole set of models that are going to emerge. It's kind of like cloud computing. When cloud computing first came out, it was people almost viewed it as a Boolean type of thing. You were either privately hosted or you were in the cloud. And obviously the situation is much more nuanced in a lot of cases. So there'll be some great challenges and opportunities around analytic sharing. We had a discussion with Marshall last night around kind of this challenge of a learning analytic, right? So if you took an analytic and you take machine learning, imagine analytics continuing to get better in individual organizations. Well, now how do you aggregate those improvements in the analytics across a whole community? So some really fascinating technical challenges, which we will work our way through. Where I've seen most of that right now is around having experts tune analytics, right? So you may have an analytic, you may have some machine learning behind it, and you've got expert analysts that can help the analytics sort of get better over time. So there's a person in the middle of that. One other thought here around this business of sharing analytics. So if you think about sharing data, and we've been at that for a long time across enterprises and across organizations. One of the things that I've observed, and we were talking over dinner a couple nights ago, is there's this interesting inverse law, and that is the number of participants and the size of the organizations trying to share data. You actually need to continually focus on the specific things that you're trying to share. And quite often, it's the opposite, right? So if you work across a whole community, and I've seen this happen more times than I can count, the community looks at the aggregate interests of the enterprises, and that becomes an intractable problem. Whereas if you take the intersection of the community, then that can be where the real sweet spot is for bringing the community together. A specific example around this, really to kind of drive the concept home. So many years ago, it's probably 10 years ago, we had a challenge that we were looking at across our Department of Defense customers. And the challenge was in how different platforms, aircraft platforms, naval platforms, logistic systems, would communicate and share information. And a lot of these systems have very involved messaging and communication protocols. And you look at these protocols and they involve hundreds of elements, and they're very detailed. The communities that kind of advance the specific message protocols. And yet there was always this appetite for how do we better connect all of the platforms and users across the Department of Defense. And yet if you were trying to take the collective message protocols across all these systems, again, it was a problem that you couldn't solve. And someone had the insight that for 70% of what these systems are trying to do, it boils down to 3 elements. What something is, you need to be able to identify it. Where is it? Where is the soldier in the field? Or where is an aircraft platform? Or where is something in the logistics supply chain? And what time did you sample that information? So what, where, when? 3, simple pieces of information that would cover 70% of largely what these systems had to do. It turned out to be 12 elements. 12 elements in an XML schema. And that led to an explosion of connections between systems that had not existed before. So when we think about, a big community with very rich data, think about the intersection that may be the sweet spot between common outcomes that we have as a community. So the grand challenge, as Glenn mentioned, we're going to break into tables and groups. We all have stars that are color-coded here. And, for the grand challenge, think about the common outcomes that we all have, where we've got collective expertise that we can bring to the table, and, some of the challenges or the barriers that we need to work through and overcome for sharing information. I'll give you one more example, just to kind of illustrate the realm of possibility. So several years ago, one of the sponsors that we support is the FAA. And the topic was around airline safety. And so there's a common outcome everyone has. And the FAA had information. The airlines had proprietary information about their own inspections and procedures, and the manufacturers had data. And what we were able to put together was a secure information sharing environment that protected the equities of all of the participants, the airlines, the manufacturers, the FAA, and yet it allowed us to do analysis and to do trending that any one organization could not do. And so it has led to significant insights around airline safety that has benefited the whole industry, benefited the FAA. So again, it was a shared outcome. It was leveraging collective expertise in data, and that model didn't happen overnight. I mean, I made it sound like it was a piece of cake. It was not. It took probably 2 years to overcome the different barriers around setting up that information sharing environment. So once we've got a couple more speakers, but once we break into groups, think about the topics that we've heard over the last couple of days that are possible topics. UVA Health has certainly got a few in their hip pocket if they need to sort of jumpstart things, but they've talked about a cross-correlation metric from NICU monitors for hospitals across the region. They've also talked about EKG-based detection of patient conditions, again, aggregating across hospitals. So looking at the topics, the opportunities for collaboration, and then how do we actually get started as a community on the most promising of those opportunities. So thank you for your attention. It's been a real interest to me and a real privilege to join you over the last couple of days, and look forward to great things ahead. Thank you.